Is there room for more integration of services?
Yes, there's absolutely room for more integration of services. I think the criminal justice system is a great opportunity to talk about recovery-oriented systems of care. I view the work that TASC has done in many ways as if we were the organization or the structure that facilitates a recovery-oriented system of care for people involved in the criminal justice system, because what we're able to do with in partnership with the justice system, who has leverage over the individual we're working with, is stay engaged with them in a way that enables us to wrap around all kinds of services as they need them at the right time with the support of the justice system. So whether it's primary residential or health care that's necessary, or housing support, or employment and education support, all the way through to recovery supports that sustain them long past their justice system involvement. And I think that because of the time of involvement that the person has in the justice system, it's a perfect place to wrap all of those other supportive services around them.
Melvin, does your association embrace that concept? And if so, how engaged are you in terms of promoting those ideas?
I guess we'll talk about a lot of different issues. Certainly corrections administrators across the country think too many people are coming to prison. We've seen populations increase, like in California, where now they're talking about releasing 40,000 inmates before it's their time to go. We've sent way too many people to prison. Correction facilities' responsibility is to protect the people of the community. Safety is first for the community, and then for employees and all for those who are incarcerated. But the dilemma for us is we can only take what's ever sent to us. If we are to advocate, we're advocating to stop the criminality. We've created a whole new society in America since about the early 1980s of making criminality of people who use or abuse substances. They're immediately sent to us. And until the public responds and understands that it costs billions of dollars in their states to send people to prison for what results, I don't think things will change. We agree that community corrections should play a much more active role than it does now. We need to, when we release people, you can't just give them $40 and a new suit and expect them to be successful. There's no chance of that, or very, very little chance. What we would embrace is an active interaction with community organizations, so when we release people from correction facilities, that they have some place to go, not just back to where they came with no assistance. The association believes that there should be a transition, and without that transition, your chances of success are very small.
And Faye, that transition also takes into account parolees, and you were mentioning before the particular cases with the parolees and what ought to happen. You want to review that with us again?
Well, the best model is probably the one that Franny experienced, where she got access to good quality treatment in prison. She had an opportunity to go to a recovery halfway house type environment where she could stabilize herself. You know, if you're away from the community 2 years, imagine trying to find a place to live, trying to figure out how you're going to make enough money to pay your bills, utility bills, rent, food, clothing. I mean, it's a complicated piece. And, so, you have a recovery house scenario, and then you have the opportunity to, ease your way back into the community with work and treatment and reestablishing yourself. So those are the connections at the system level. There's also a therapeutic piece that goes with that. And that's really helping people have the confidence that they can do it.
I'd like to say in the state of Oklahoma, in the 3 major prisons, the Department of Mental Health and Department of Substance Abuse has inserted discharge managers into these 3 major prisons who will work with people, and then they refer them to us. We have, for our caseload, our own specific parole and probation officers who work closely with us. So what we're talking about, the wraparound services and everybody kind of being on the same page, that makes the world a difference. If one of my people relapses, I go with them to the parole office and I say, I recommend that you be totally honest with him, and let the chips fall where they may. My guess is he's going to work with you. And I've taken 2 people in to do that, and he works with them. He said, I understand addiction. Then I explained to them, that doesn't mean he's a sucker. You know, he will violate you, but he will give you a chance as long as he sees that you are trying to do what you're supposed to do. And the wraparound service is really, really good. And I think part of that should be system-wide, but it has to begin with the little guy.
So it's really getting the municipalities to understand that within their structure, they need to set up these systems, the states to do it for the state prison systems. How do we do that, Pam? Simple question.
Yes. I think you need committed leadership with a long view. Leadership at the local level, people who are invested in their communities and who are concerned about the people coming back, and or the people who are leaving their communities and who want them to stay back in the communities and not be destabilized. I think you need committed leadership at state and county levels that work together and support the statewide organizational change that's necessary. People have to take risks, and you have to have a public education campaign that involves a lot of different stakeholders so that people understand what you're doing, so that they know and support the changes that they see. So that they understand why not everybody is going to prison, or they understand why people are back so soon and what's going on, and understand the investment we're making and the payoff for them. One of the things that occurs to me as both Faye and Franny are talking is that most of the research says that doing services in prison, the effect of doing services in prison wears off unless you have all of the wraparound community stuff and support them in transition to community and stabilize them there. So that if we're really going to make the most out of our investment in institutional services, we've got to invest in community-based services as well.
Certainly, Faye, CSAT has some re-entry initiatives that have been successful, and others. In essence, how do we get more support for that? I know that the public education is an aspect of it, but should the associations that are involved in criminal justice be more active on the policy side?
Well, I think for us to move ahead as a country, to kind of correct our past of the past 30 years, we really have to think about new policies that are interagency. What Pam described, what Franny described, all were related to this issue of you have all these segments of government that have to talk together. There's new technology, health technology, that will allow that to occur. For example, many years ago, we started in the state of Maryland a program that's now called the SMART system. It's a web-based interagency program that shares data across individuals. It's consent-driven, but that means that everyone's working together for the benefit of a particular person, and it doesn't matter if they're involved in the criminal justice system or what phase. It's basically about, that particular individual and what level of care they need and what services they're getting. And then, we have the checks and balances so drug courts can use it. So, there's technology that's readily available that can get past all the system noise of the past. We also need leadership at every level to basically restate that this is not just a corrections problem. It's not a police problem. It's really a community problem. We have, the work that CSAT has done in terms of the recovery communities about trying to put funds available out there to support treatment within drug treatment courts, within reentries is important. But those are insular because they just provide the treatment piece. And everything we know, Franny's articulated really well, people need support. And so it's not just about a clinical session. It's about providing holistic support for housing.
Well, it's about everything.
Right. And so, this is where we need that type of leadership to move ahead.
Yeah. When we come back, we're still going to talk about more of the programs that are available for individuals that are in the system. We'll be right back.
For more information on National Alcohol and Drug Addiction Recovery Month, events in your town, and how you can get involved, visit the Recovery Month website at recoverymonth.gov.